Good morning and welcome to our newest edition of United We Learn. Thanks for joining us. I'm Frank Lynch. I'm co-chair of the 2020 campaign. It's been my honor to have been a volunteer with United Way for more than 15 years. And through this time, I've seen this United Way grow and change in order to respond to the needs of this community and to continue to grow as a cutting-edge local United Way and social service agencies, a well-regarded and well-respected one throughout the nation. A few of these changes bringing the partnership of several national programs to our local community. We heard about a couple of them earlier. One was Dolly Parton's Imagination Library. Others were multiple volunteer initiatives the United Way was part of. Today we're going to hear about three more initiatives the United Way engages in: My Free Taxes, 211, and Familywize. During our program, please ask questions using the chat option. We'll wrap up in about 15 minutes, and United Way staff will stay on to address any of those questions. If you're watching the recorded version and have a question, please send it to feedback@uwcil.org. Joining me today to discuss our United Way programs are Katrina Hayes, our Director of Community Impact, and Mitch Baker, our Community Impact Manager. These two, with the support of our volunteers, help ensure that these programs run smoothly and impact the lives of thousands of people throughout Central Illinois. At the conclusion of our presentation, I hope you'll be able to name each of these programs, and in a pinch, remember that these programs exist if and when you hear someone who could benefit from them. So to kick us off, I'll turn things over to Katrina Hayes. Thank you.
Good morning, everyone. Here at United Way, we fight for the basic needs, education, financial stability, and health of every person. We support this work in several ways, the biggest of which is investing more than $1.1 million into high-quality programs, helping to bring about positive outcomes for some of the most at-risk individuals and families in the community. However, as you heard about Alice on the last United We Learn, we know that every family, in one way or another, may find themselves in the need of a little assistance. This may look like trying to save a few extra dollars to make the budget work or go a little further, or they may find themselves falling on hard times and needing to know where to go when they are confronted with a social service problem, but they may not know where to start. It is for these reasons that our United Way began to administer programs through national partnerships. When we think about the network of partners we are a part of in the community, in some cases, there are programs that best fit at United Way and can be best leveraged through our national partnerships through our network membership with United Way worldwide. These programs, which we will continue to talk about today, complement many community services and help to serve more than 1,000 people each year. And with that, I will turn it over to Mitch.
Thanks, Katrina. So as our United Way adopts programs locally, we first ensure alignment with our mission. Now, Basic Needs has us focused on supporting the most vulnerable with emergency food and shelter needs. However, if you tuned into the recent Hunger and Homelessness Awareness Week interviews hosted by the Heartland Continuum of Care, you would know that we have hundreds of local families on the brink of homelessness. That means a critical component of our community's success is prevention and diversion. Two services that are critical to this work are renter mortgage assistance and utility assistance. Another is support for food. But with numerous programs and grants offering assistance and numerous pantries with fluctuating hours, it can be difficult to know where to start to figure out which of these programs are right for you or your family. This is why United Way of Central Illinois is proud to provide 211 coverage for Sangamon and Menard counties. 211 is a toll-free number individuals can call 24/7 every day of the year to receive information and referral services on a huge swath of services. And to get an idea of what you could call 211 for, check out the slide. But when our trained operators answer the phone, they not only help identify and provide information about the services you identify, but they'll also provide additional information as they communicate with you. Locally, we know that more than 75% of 211 calls are related to hunger and homelessness. But just like any resource list, 211 may not always be able to address your service need immediately. That's why callers are always encouraged to call back as information is being continuously updated. Now, 211 also provides a critical resource to our community in the event of a natural disaster. Through our partnership with the Sangamon Menard Local Emergency Planning Commission, we stand at the ready to be able to provide critical, real-time information if our community is impacted by any disaster. Now, ensuring we have 211 allows for coordinators to have one place to provide information where people need to go for those non-life-threatening needs in order to free up the load and ensure our 911 calls come through efficiently and take top priority. Now, lastly, because 211 is certified through the Alliance of Information and Referral Systems, or AIRS, operators are trained in the event of emergency mental health situations, and 211 has access to a universal language database, so they can assist callers even if English isn't their first language. Now, broad access to needed services is critical to our community, and community really is the central focus of our health initiatives at United Way. So when we think about healthcare, we know that many people, in an effort to make their budget go further or to keep their lights on, may forego necessary medication because of high prescription costs. However, as we have a mission to activate and inspire our community to get healthy and stay healthy, a key part to activation, or getting in the driver's seat of your own healthcare, is ensuring that you take medication as prescribed to aid your wellness. Now, this is where Familywize comes in. Familywize is a prescription drug discount program that requires no registration, there are no income requirements, and it can be used by anyone, whether you have insurance, have no insurance, or find yourself with less insurance than you need. Now, Familywize is not the only discount card in town, but it does add to the suite of services available in our community. Discount prescription drug programs each work a little differently and have access to different drug manufacturers. So, while GoodRx might help you with one drug, Familywize could help you with another. Now, there is no penalty to use a discount prescription drug card like Familywize. It just helps provide more control over your healthcare. So, if your prescription was $200 with insurance, but Familywize can help get it for you for $150, that's a no-brainer. Now, we know through personal stories and the millions of dollars in local savings here in our community that this program has helped many individuals in times of need. Now, whether that need comes from getting sick during a job transition or unemployment, helping individuals that fell into the Medicare donut hole, or needing immediate access to medication versus waiting for those proper approvals in order to get full coverage from your insurance. Medical care can be complicated, but if there is one simple challenge we have for you, it's to take the Familywize card or look at the app or website to see if it can help save you some money the next time you're at the pharmacy counter. Familywize is accepted at more than 60,000 pharmacies nationwide, including Walgreens, Walmart, Kmart, Target, CVS, and Rite Aid. Just remember, it is wise to use Familywize. Katrina?
Thanks, Mitch. The last program we will cover today is one that has changed over the years. First, it only assisted individuals and families that had a household income of less than $45,000, and now it covers anyone and any family. This program is My Free Taxes. The saying goes, the only certainties in life are death and taxes, right? So why not try to save money where you can on an activity you have to do every year? This program is something we particularly hope that individuals who join us will talk to their young colleagues about. On average, filing your simple W-2 through a service can cost you upwards of $80. And for those just starting out trying to tackle student loans, if they could save that money, they should. This is where My Free Taxes can help. My Free Taxes is backed by H&R Block and assists any individual and or family filing a simple return for free, not only for federal taxes, but also for state taxes. You can complete your taxes online or using your mobile device. And if you have questions, you can speak with IRS certified specialists in English or Spanish through the chat feature or over the phone. Now, if you do not have a simple return, we definitely encourage you to seek out a qualified accountant. For those of you joining us thinking, wow, I'm in HR and I have many employees who could qualify for this program because there is no income restriction, and we want them to save money, especially during this crazy season of life. But where do we start? And to answer that question, we would refer you to our resource toolkit on our website that contains sample emails, flyers, and other documents to help you spread the word about this service. I want to thank each of you for joining us today, and I hope you enjoyed seeing some of the results these programs have helped to achieve locally. With your help, we can continue to spread the word about these programs and more. And now I will turn it back over to Frank to close us out.
Thank you, Katrina and Mitch. I really appreciate this United We Learn today. I've heard this information presented before, but it's always good to be reminded. Personally, because of this information, I've been able to refer friends and clients to a number of these programs. I know that those programs have worked for them. I frequently have an opportunity to refer people to 211 in particular, and I know that that is an enormous resource for the community. The fight for basic needs, education, financial stability, and health is for everyone. I've always heard people say, well, I don't think these programs are for me. They're for people who really need them. But everyone deserves to save some money. Everyone deserves to have control over their health, and everyone deserves to know that if they fall on hard times, they don't have to go it alone. They have somewhere to turn for at least that first step. This is what being an advocate is all about, and I hope today each of you will go out and advocate as well as share this information with those who need it. These are three important parts of a whole spectrum of United Way programs that raise up our whole community. Our next United We Learn session on December 18th will highlight our health issue area and the amazing work being done in partnership with critical programs. This concludes today's programs, and we will keep the session open for a few minutes to address any questions that have been posted in chat. Any questions we don't get to in the next few minutes will be addressed and saved on our website. In addition to any questions on the recorded webinar, we'll also make available a one-page PDF that highlights these programs to help you continue to spread the word. Thank you. Have a great Friday and a wonderful weekend.